In 1975, a consumer census indicated that the average American consumed an astounding 539 pounds of dairy food in the last year. Just about 30 years after the popularization of the refrigerator, dietitians found this number shocking. But only about 45 years later, this number increased by nearly 25%, all the way to 655 pounds of dairy products per year. In 2020 alone, the ice cream industry grew by 4%, yogurt by 3%, and butter by 2%. Michael Dykes, a doctor of veterinary medicine and an agricultural expert, is quoted as saying that we consume our dairy differently than a generation ago. With the implementation of better shipping methods, cheese from Wisconsin and ice cream from Vermont has been able to spread all over the country at a rapid pace. Even though these numbers may be shocking, they could be even higher. The main thing halting the exponential growth of the dairy industry is a condition that affects nearly 65% of the global population to some extent: lactose intolerance. Lactose intolerance is an inability of the digestive system to break down the main sugar found within the milk used to create your favorite dairy product, called lactose. After passing through the stomach, lactose begins making its way through the small intestine. The intestinal epithelial cells would usually produce a digestive enzyme known as lactase, which could break down lactose into glucose and galactose, two readily available monosaccharides, or simple sugars, for the cells of the body to use as energy. However, people with lactose intolerance are unable to produce an adequate amount of lactase for their diet, causing the complex sugars to pass through their small intestine into their colon. Here, undigested disaccharides and polysaccharides, like lactose, will invoke the release of extra fluid into the colon to try and pass through to the rectum. Within this fluid is bacteria that will work to ferment this lactose into something the body can use for fuel, and in this process, releases gas as a byproduct. This can cause someone with lactose intolerance a variety of symptoms, most commonly extreme gas, diarrhea, bloating, stomach pain, and nausea. If someone has these symptoms after consuming lactose, the best bet is to talk to a doctor. Once talking to a physician, one may get referred to a gastroenterologist or an allergist in order to get diagnosed. To be diagnosed with lactose intolerance once they are there, they perform a lactose intolerance test. This test includes you taking a lactose solution. Then, once consumed, they will measure the amount of glucose in your blood. Low levels of glucose after taking the solution would mean the levels of glucose in your bloodstream did not rise like they should, meaning the person is lactose intolerant. Another way someone may get tested is through a hydrogen breath test. Usually, one's breath has a small amount of hydrogen in it, but if they cannot properly digest lactose, these levels of hydrogen will rise. Doctors measure this by having someone periodically breathing into a container after consuming a lactose solution and measuring the hydrogen gas in the breath of the person. Upon diagnosis, there are three main types of lactose intolerance one might have. The first is primary lactose intolerance, and this is the most common type. People with primary lactose intolerance will typically develop the condition in adolescence or adulthood. During those years, the person's body will produce less lactase over time. The second most common type of lactose intolerance is secondary lactose intolerance, which develops as a result of underlying conditions damaging the lining of the small intestine. Diseases such as Crohn's disease, celiac disease, and some medicines like those associated with chemotherapy may induce a form of lactose intolerance. If these diseases are cured or the treatment stops, the symptoms of lactose intolerance may too go away. The last type of lactose intolerance is congenital, also known as developmental lactose intolerance. This is the most serious form, as it is a result of a baby being born without any lactase from their mother and an inability to express the LCT gene for lactase production. Signs of lactose intolerance will become apparent as soon as the baby with congenital intolerance begins being breastfed or fed with a lactose-conforming solution. Even with new advancements in lactase-related research, there are still no long-term treatments for lactose intolerance. The only way to lessen the symptoms is by taking lactase tablets before consuming dairy products. Lactase tablets break down the lactose in dairy products after you consume them, lowering the chances of suffering from symptoms of lactose intolerance. Ways to prevent suffering from lactose intolerance are by consuming less dairy and buying lactose-reduced or lactose-free dairy products.